Hello, all. This is Dr. Shilpi Reddy, and today we're going to discuss a very important social topic of malnutrition. And yes, malnutrition in India per se is two different types. One is the undernutrition, that is a severe grade of protein energy malnutrition, and undernutrition that is seen in children, and the other grade wherein there is extremes of overnutrition and obesity in children. And today we're going to discuss in this podium the effect of obesity on children, especially the school going age group of children and the adolescent age group of children, and to focus on women and especially the girl child of the adolescent age group, and also the child going to a school age group children. This is about obesity and long term studies of obesity and malnutrition in the form of increased carbohydrate intake and obesity have proven to give a very bad effect on reproduction at a later date. That means there is an institute governing body, the European Society of Human Reproduction, which is on a regular basis doing studies on children of the school going age group and the adolescent girl child. And then the results of this kind of an epidemic of obesity and overnutrition in them and their future impact on fertility and childbearing. So they have confirmed over a period of studies and cohort studies and all these things that an amount of obesity and enhanced intake of carbohydrate and fat rich food, which increases your body mass index, especially in the children of a school going age group and adolescent girl children, have enhanced infertility issues whenever they are planning pregnancy, and a very small group even had lot of fertility issues, including remaining childless in future. So this is about something really alarming and very important to discuss in the current scenario, because we are dealing with a population set of children who are overnourished and especially exposed to junk food and varied amount of foods and a decreased physical activity that they are having. And there is so much of obesity in these kind of girl children, which is leading to problems like polycystic ovaries and hormonal imbalance and early menarche and bleeding disorders, and also a very early onset of obesity, to an extent that even 8-year old 6-year old 8-year old children are above 50 kgs. Yes, that is an epidemic of obesity. And also there are so many studies that say that girls affected by obesity during their mid childhood and adolescent are found at risk for decreased fertility, and not only fertility, at a greater risk of remaining childless. And that this has to be taken very serious. And do take care about your children, especially when they are on the higher side of BMIs, that it is really not good. And undernutrition is so detrimental for children. Lack of nutrition is so detrimental, so is overnutrition. And overnutrition has been linked to various kind of obesity and obesity related disorders like metabolic syndrome, diabetes, hypertension, increased cholesterol levels, cardiac problems, neuro problems, and so many problems associated with metabolic syndrome, and even association of metabolic syndromes for a later date cancers. So this is not only about obesity, it is about the future of girl children and their impact on the next generation when they want to have children. So it is very, very important that we curtail this epidemic of obesity, and as a measure to decrease the risk of infertility. There are several cohort studies that are proving that obesity in childhood, especially the school going age group girl children and also the adolescent girl children, and an increased obesity, definitely detrimental for their overall fertility levels in future. So it is not only about polycystic ovaries, it is not only about irregular cycles, it is about the future of the girl child that is in danger if the nutrition is not monitored. It is not only about nutrition, it is not only about food intake. We also have an enhanced responsibility to increase the physical exertion, the physical activity in them, in terms of inculcating sports or inculcating some kind of a physical activity, like whether it is dance or zumba or yoga or pilates or any kind of sports or any kind of physical exercise on a daily basis. It is about monitoring what they eat, what effectively are they burning, and how much are they leaving it on their bodies. So it is very important that we fight an epidemic of both undernutrition and overnutrition for the bright future of the children. So it is important for us to understand that obesity per se has lots of impact on children in future, and let us fight against malnourishment, be it low food intake or high food intake. Let us fight for a proper food that is going to be the health of the future children.